Now we move to sexual assault. This is a major issue in the United States. Every 2 minutes, someone is sexually assaulted in America. When you look at the data, this is a survey of women in the United States 18 years and older, the percentage exposed to violence or abuse. 16% childhood abuse, 20% rape or assault. 1 in 5 women have been raped or assaulted. Domestic abuse, 30%. Any violence in a lifetime, 40%. There's a lot of women who are sexually assaulted or raped. Do we ask about this? This is an interesting, kind of tragic situation of a woman, elementary teacher, who raped a 6th grade male pupil and actually wanted to marry him. Do we ask our patients about sexual abuse and violence? We ask about exercise, diet and weight, smoking, 29%, but safety and violence at home, only 8%. I don't think we do a very good job in assessing this. If you look at female victims, their age at the time of their rape, almost 60 to 70% between ages 12 to 24. This was the young women who are assaulted. Here's our case. A 21-year-old university student presents to the emergency department stating she was walking home after an evening class when she was assaulted by a male stranger and was raped. She's not crying. She's not upset. She looks almost without emotions. What's going on? Well, she's probably in shock. She's accompanied by her female roommate. How will we appropriately relate to her? First, we need to define what sexual assault and rape is. Rape is a legal definition. It is not a medical definition, and it is sex under coercion. When we look at some of the notable cases recently, we see how important this is. Kobe Bryant, Los Angeles Lakers player. A court case in Eagle, Colorado. The issue was not, did he have sex with a woman? He admitted to that. The issue was it under coercion or not? And you don't know that. What you need to put down is what the patient says in her words, but what you need to do is to document medically was there. The definition of rape is going to have to be decided by a court. And you want to provide the best evidence on which that decision can be made. First, of course, stabilize the patient. If she's unstable, get her vital signs. And before asking any questions or examination, obtain informed consent. In her own words, state what she says. You don't need to interpret it. Just state what she says, and then document thoroughly in your examination what you found, either photographs or drawings. I think it's important that we take seriously when a woman says she was raped. And yet here are 2 women whose testimony in a child molestation case put a man behind bars for 20 years inappropriately. He didn't rape them at all. This is the former deputy president of South Africa and the rape trial for him, which was last year in 2006. And the issue was not whether he had sex with her. He says she invited him. So the issue of coercion, I think, is significant. There was a couple of Dallas Cowboy football players who were on public media accused of raping this woman. And what did she do? About 2-3 days later, she said, I just made it up. This kind of stuff is what makes people take women who were raped as if they were really just making it up. They don't take it seriously, and I think that's unfortunate. We have at Loma Linda University Medical Center a sexual assault examiners training program. You need to know what you're doing and do it properly. And you need to have training to do this. This is not just any emergency department physician or OBGYN doctor who's on call. You need to document in a pictorial fashion what you found on physical examination. This is for an adult. This is for a child. You need to get appropriate specimens, combed pubic hair, plucked pubic hair, 4 vaginal swabs in a dry test tube, vaginal smears for sperm, vulvar smears for sperm, all kinds of different specimens. Dried up secretions scraped from skin, fingernail debris. And then you have to put these appropriately in containers. You have to document who you gave them to and that they were not tampered with. When we look at some of these big trials like O.J. Simpson trial, one of the big issues with the evidence was that the defense said it was tampered with. It was not a proper chain of command as it was passed along. So you need to make sure that your specimens were appropriately managed. Pictures may be helpful. Photographs, such as contusions of the eye, of the thigh, cutting of pubic hair. Here you can see that there is abrasion from friction of the vagina. But can you say this was consensual or was it coercion? You don't know. Here there is a laceration of the perineal body. There can be gentle sex, there can be vigorous sex. And it doesn't mean that there was necessarily rape. But you document what you found. Antibiotic prophylaxis. I think it's reasonable to give a dose of cefixime to prevent gonorrhea, azithromycin to prevent chlamydia, metronidazole, trichomoniasis, hepatitis B immune globulin for hepatitis B, and more recently, the recommendation is to give HIV prophylaxis with AZT for 4 weeks. And then Plan B for pregnancy prevention, the levonorgestrel that we talked about earlier. The recommendation to give rape victims HIV prophylaxis is recently from the CDC in the last few years. So you should be aware of that for the exam, that we want to give HIV prophylaxis for women who have been sexually assaulted. And that's the end of our chapter on sexuality.